Hello, everyone. My name is Sally Sobel-Radke, and I am a Doctorate of Nursing Practice student at the University of South Alabama College of Nursing. The following is a presentation of my quality improvement project. My project was an examination of how the implementation of a substance abuse educational in-service improved neonatal intensive care unit nurses' perspectives towards opioid-addicted mothers and decreased the length of stay for infants hospitalized for intrauterine exposure to maternal opioids. Withdrawal in infants exposed to intrauterine drugs, specifically opiates, has become a worldwide epidemic, with one infant born every hour showing signs of withdrawal. Infants born to mothers with a history of prenatal drug abuse have higher rates of NICU admissions, secondary to immediate withdrawal behaviors or necessary continued observation for potential withdrawal. Infants born following intrauterine drug exposure usually begin exhibiting signs and symptoms of withdrawal in the first 48 to 72 hours after delivery. Since the 1970s, neonatal abstinence syndrome, or NAS, has been a diagnosis given to infants withdrawing from maternal opioid use. NAS is a consortium of symptoms specific to infants experiencing withdrawal from intrauterine drug exposure, mainly opioids. Studies have focused on the nurse's ability to properly utilize scoring systems for necessary medical interventions for infants experiencing NAS. Literature has debated as to which pharmacological intervention is superior for the chemical intervention for infants with NAS. From 2012 to project completion time in 2015, there had been an increase of 1 to 2 babies per 6 months with neonatal abstinence syndrome admitted into the neonatal intensive care unit at the quality improvement site. For Patrick et.al., in 2012, the average length of stay for an infant with NAS was at 16 days at a cost of $3,400 per hospital day. The length of stay for infants with NAS was 18.5 days at the project site, which was 2.5 days greater than the national average. The background of this quality improvement project is as follows. Research has suggested nurses' perspectives towards opioid-addicted mothers can impact the bonding between the mother and her newborn. Increased training and education of nurses related to substance abuse has been found to improve nurses' knowledge and enhance mother-infant bonding. Healthcare workers in general tend to have negative perspectives towards patients who use and abuse substances. It has long been established that NICU nurses tend to have negative perspectives towards pregnant women who use illicit substances, can be judgmental, and are lacking in knowledge regarding substance abuse. Adversarial nurses' perspectives have been shown to be a barrier in the promotion of effective maternal-infant bonding. Studies have established rooming in and increased time spent between the opioid-addicted mother and her infant has decreased the length of stay for infants with neonatal abstinence syndrome. Opioid-addicted mothers who spend additional time with their infants are better equipped to understand the specific care their infant requires. However, despite the evidence, many NICUs have not provided supplementary educational programs for nurses to enhance their understanding of substance abuse. A component of total quality management, benchmarking is a continuous process by which an organization can measure and compare its own processes with other organizations that are leaders in a particular area. In 2014, the Vermont-Oxford Network published the following benchmarking statement: to create a culture of compassion, understanding, and healing for the mother-infant dyad affected by NAS. The National Quality Forum in 2012 stated patient, family, and caregiver experiences are to be related to quality and safety improvements. The Northeast Neonatal Benchmarking Group in 2006 Noted staff are to be trained and supported to promote a non-judgmental attitude towards care and to raise awareness of this population. In 2001, the Institute of Medicine stated care needed to be patient-centered and equitable for all. The mission statement of the Quality Improvement Project site is to respond with excellent service, respect, and compassion. In 2011, the American Nurses Association recognized more needs to be done on the topic of substance abuse and published the policy statement as follows. Nurses in maternal child services may not be fully educated in the needs of patients with substance abuse problems and the special needs of infants experiencing NAS. Nurses are encouraged to seek educational programs offering additional training in mental health and drug addiction fields. In 2001, the American Nurses Association published their Code of Ethics. The nurse establishes relationships and delivers nursing services with respect for human needs and values and without prejudice. An individual's lifestyle, value system, and religious beliefs should be considered when planning health care with and for each patient. Such consideration does not suggest the nurse necessarily agrees with or condones certain individual choices, but that the nurse respects the patient as a person. A question was constructed for the Doctorate of Nursing Practice Quality Improvement Project utilizing the PICO format. Would the implementation of a substance abuse educational in-service improve the knowledge and perspectives of NICU nurses towards opioid-addicted mothers and decrease the length of stay for infants with neonatal abstinence syndrome? The project purpose and goals: to improve NICU nurses' knowledge and perspectives towards opioid-addicted mothers following a substance abuse educational program, to decrease the length of stay of infants with NAS after the presentation of an educational in-service on substance abuse, and to assist in the benchmarking attainment and decrease financial expenditures related to the care of infants with NAS. Institutional Review Board approval was granted at the project site and at the University of South Alabama. The NICU for the project was located in a suburb outside of Metropolis with a population of approximately 700,000 people. 75% of the NICU staff were in the age range of 56 to 70 years and had greater than 20 years of NICU background experience. Focus groups were held to determine neonatal nurses' perspectives on substance abuse knowledge and current care practices. Staff involvement allows ownership and can facilitate the change process. Individual group members need opportunities for autonomy and ownership of project changes. Focus groups can propose discussions related to perceptions, beliefs, and attitudes regarding a particular topic. Information gained from the focus groups was utilized to tailor a 60-minute educational presentation on substance abuse for the NICU RN staff. The implementation tools utilized to measure the perspectives towards substance abuse and parenting were the Attitudes Towards Drug Use and Parenting Survey and the Substance Abuse Attitude Survey. Both of these tools have been shown to be valid and reliable. Created in 1999, the Attitudes Toward Drug Use and Parenting Survey is a 20-question survey specific to drug use and parenting and utilized the Substance Abuse Attitude Survey as a developmental template. The Substance Abuse Attitude Survey, created in 1985, is based on personal opinions and experiences of healthcare workers to measure attitudes regarding general substance abuse and uses more statements than the Attitudes Toward Drug Use and Parenting Survey. It has the answer choices of agree or disagree. Both of the tools were adapted for specific use of this quality improvement project by the Doctorate of Nursing Practice project manager and author. An educational in-service on substance abuse was created and presented to the NICU RN staff utilizing the information gained from the focus groups. The substance abuse educational in-service contained a segment of NICU RN statements regarding their feelings towards opioid-addicted mothers, which was obtained from published literature. The NICU RN statements were compared with statements from the opioid-addicted mothers on their perspectives while being in the NICU as a parent. Providing the bridge between the RNs and opioid-addicted mothers' statements was a neurophysiology segment regarding opioid addiction. Due to the sensitive nature of statements on attitude surveys towards substance abuse, participants were asked to sign the consent form but not submit these to the Doctorate of Nursing Practice project manager to assure privacy and allow full autonomy in truthful survey completion. All pre- and post-intervention attitudinal surveys contain no identifiers to guarantee confidentiality and protect the NICU RN participants. Participants were given the option of attending the substance abuse educational in-service without completion of the substance abuse attitude surveys. Pre- and post-test questionnaires have been documented as successful tools in the evaluation process. Pre- and post-intervention surveys were analyzed to measure changes in perspectives following the substance abuse educational in-service. Post-intervention surveys were again distributed at 6 months to measure changes in perspectives over time. Also, length of stay for infants with NAS was tracked for 12 months prior to and 6 months following the intervention of the substance abuse educational in-service. Neonatal nurses showed overall improvement on post-intervention surveys towards substance abuse immediately following the substance abuse in-service. The nurses continued to show improvement on post-intervention surveys towards substance abuse at 6 months following the intervention of the substance abuse in-service. Performance outcomes were measurements of knowledge and perspective changes of the NICU RNs as evidenced by improvement on post-intervention attitudinal surveys. Summative impact evaluation measuring longer-term outcomes were demonstrated by knowledge and perspective changes over time on post-intervention attitude surveys and comparison of length of stay for infants diagnosed with NAS at the conclusion of the project. This slide highlights the most dramatic changes which occurred immediately following the substance abuse educational in-service and also demonstrates continued improvements in NICU nurses' perspectives over a 6-month time period. As you can see by the statement selected, there was an 82% increase in the statement of helping opioid-addicted mothers is worthwhile, with 100% of participants agreeing with the statement at 6 months. The statement of opioid-addicted mothers are capable of behavioral change showed an increase in 45%, with 91% of participants agreeing with the statement at 6 months. The statement of opioid-addicted mothers created their own problems showed an increase of 37%, with 9% in agreement of the statement at 6 months, compared to 46% in agreement with the statement pre-intervention. The statement of opioid-addicted mothers are deceitful, unreliable, and uncooperative showed a 23% change, with 73% of participants disagreeing with this statement by 6 months. During data collection prior to the substance abuse educational in-service, a total of 10 infants were treated for NAS in the NICU. The average length of stay during this time for these 10 infants was 18.5 days at an approximate cost of $63,000 per infant. Following the substance abuse educational in-service over a time period of 6 months, 7 infants were admitted and treated for NAS in the NICU for a total of 114 days. The average length of stay for infants admitted to the NICU for withdrawal treatment greater than 5 days was 16.3 days, demonstrating a decrease of 2.2 hospital days. The projected cost savings as a result of this Quality Improvement Doctorate of Nursing Practice Intervention project was $8,000 per infant. The results of this Quality Improvement Doctorate of Nursing Practice project: the NICU nurses improved their knowledge and perspectives and were more in alignment with the benchmarks and policy statements. The overwhelming attendance at the educational in-service by the vast majority of NICU staff, as well as labor and delivery staff, exhibited a unified interest by RNs regarding the topic of substance abuse. The financial impact of this quality improvement project was realized by decreasing the length of stay by 2.2 days over a 6-month time period, which is more in alignment with national averages, and showed a cost savings of $8,000 per infant. The conclusion and the practice implications. Nurses have the ability to positively impact the bonding of the opioid-addicted mother and her infant. Nurses can positively influence the length of stay for infants with NAS. Nurses desire to expand their knowledge base regarding the topic of substance abuse. Future recommendations. For outcomes to remain sustainable, additional knowledge would be beneficial utilizing this substance abuse educational in-service as the foundation for further knowledge building. Ongoing provision of research and literature to the NICU staff regarding substance abuse would be useful to complement existing knowledge, as would supplementary in-services on substance abuse. New RN staff orienting to the NICU would benefit from the substance abuse educational in-service as a component of their orientation materials. Although not a part of this quality improvement project, patient satisfaction surveys from opioid-addicted mothers could have been an additional metric to further assist in the determination of long-term success and project sustainability. I hope you enjoyed my Doctorate of Nursing Practice Quality Improvement Project presentation. I want to thank you very much for your time and attention.